Prynhawn da, fy enw yw Anlwyd, Cadeirydd y Bwrdd Iechyd. Croeso i chi gyd, ac i'r ail sy'n gwylio drwy'r ein sianel YouTube. Hoffwn eich croesawu y gyd y cyfarfod cyffredinol blynyddoedd hwn, a gyfer Ffwrdd Iechyd Prifysgol Aneurin Bevan. Gobeithio bod yn cyfarfod yn llawn gwybodaeth. Good afternoon to you all. My name is Anne Lloyd and I am the chair of the Health Board. Welcome to you all to our annual general meeting, and especially to those who have been able to join us on YouTube, on our own YouTube channel. This is the 2019-20 annual general meeting, and I do hope you find it of interest to you and informative. It has been, could I just go through some etiquette points? If any of our independent members or executive members would wish to ask a question, it'd be really helpful if you could raise your hand rather than putting it in the chat bar, as that is quite difficult to keep a track on at the moment. So thank you for that. I have apologies from Nicola Prigodic, the Director of Planning, Mererid Bowley, who is the Interim Director of Public Health, and she is replaced by Will Beard, one of our consultants in public health, and Nick Wood, who is our Director of Primary and Community Care and Mental Health, and Mel Laidlaw is here representing him. In attendance, I'm really pleased to welcome Alan Davis, the Chair, and Angela Mutlow, the Chief Officer of our Community Health Council, with really excellent relationship and who really represents the views of the population on our plans and plans for the future very well indeed. The format for this annual general meeting is that Judith Paget, our Chief Executive, will provide an overview on this year's performance and achievements as part of the annual report. She'll be followed by Glyn Jones, our Finance Director, who will give an overview of the finance performance, followed by the Director of Nursing, who will go through the annual quality statement with you. However, I should like to start this meeting and take the opportunity of really paying tribute to our staff and our volunteers, particularly during the course of the pandemic, which, as you all know, still continues. They have been truly awe-inspiring. They have worked so diligently and so hard in the most awful conditions, uncertainty found, and they have diligently undertaken their responsibilities. They really have been magnificent, and we as a board are so proud of them. So sincere thanks to our staff and volunteers. I have received a number of questions which I will go through after the presentation. So if I might ask Judith to please start with the annual report.
Diolch, Anne, and Prynhawn da pawb. I'm delighted to provide an overview of the Health Board's annual report for the year 2019-20. As Anne has said, at the end of the financial year in March 2020, the Health Board, along with other NHS organisations, saw unparalleled demands on our services due to the COVID-19 pandemic. This required changes and adjustments to the ways in which we delivered our service and governed our organisation. Our annual report recognises these extraordinary circumstances and the amazing work undertaken by our staff and our partners to respond to the pandemic. And again, to add to the Chair's comments, I want to say my own personal thanks to everyone for all that they have done, and we are immensely proud of everyone for their efforts. And we recognise, of course, that the impact that this is having on many occasions on their own health and well-being of our staff. So thank you to all of them. I also want to take a moment to remember those who sadly passed away during this time and those who've been seriously ill and continue to be unwell, recognising the impact that this has had on them, and their family and friends. Our annual report does recognise the progress that we have been making as an organisation during the year 19 to 20, highlights some of our continuing challenges, but importantly celebrates all those successes of the Health Board, and particularly the successes of our teams and individual members of staff who've made progress during the year 19 to 20. We've emphasised in previous reports how our staff remain our greatest asset, and the progress that's been made during the year, and particularly towards the end of the year when the pandemic came, re-emphasises this view. It's down to the commitment and hard work of all of our staff and those who work with us that's enabled to make real progress in the interest of the people we serve. Our staff continue to appear on award shortlists, win awards, and are recognised nationally and internationally for all the excellent work that they do. And you will see examples of that excellent work in our annual report. We've made considerable progress in the year with the implementation of our Clinical Futures programme. The construction of our new hospital at Cumbria, the Grange University Hospital, has moved on at pace, and is now the opening of that is just a few weeks away. This will help us support our continuing response to the pandemic and also support our plans for the winter and thereafter. However, the changes that we are making go much further than just one new hospital. We've been redesigning the way our local services are delivered to make them fit for the future. And that includes moving more of our services into communities and delivering services that are closer to home to the people who use them. In recent weeks, we've been engaging and communicating further with our communities, partners and stakeholders to explain what our health system will look like when our new hospital opens. There are so many changes afoot, but most importantly, we want to ensure that patients and the public are aware of where the services are located, how to access them, and where they're provided. In our annual report, we also highlight that as an organisation, we're committed to learning and improving in the interests of our patients and our staff. We've been learning from our experiences of the pandemic, and we seek to adopt these new arrangements as we move forward. We've been using social media in a great deal to communicate with our patients and with our local communities. We've been providing virtual consultations with our patients, holding virtual meetings like this one, and doing so much in terms of adapting the way we work in. As new opportunities arrive and new technologies emerge, we will continue to adapt and improve the way we deliver our services so that the people that we serve in our communities can be assured of the highest standards of care. Of course, staying the same for us is not an option, nor has it ever been, and more changes and service developments are afoot. We continue to develop and innovate as we respond to the Welsh Government's aspirations for a healthier Wales. We will continue to make progress on delivering against our wellbeing objectives in line with the Wellbeing of Future Generations Act, and also working with our partners through the Regional Partnership Board to respond to the requirements of the Social Services and Wellbeing Act. We want to provide integrated health and care services across our area, and will work tirelessly to do that. We continue to focus on the quality of care and patient safety, and this has been a particular focus for us during the pandemic. It always has been a focus for us, and Rhiannon Jones will say a little bit more about that in our presentation of our annual quality statement shortly. We're also encouraging our local communities to improve their own health and well-being and stay well and stay safe. Because of the pandemic, we are working now more closely than ever before with our partners, such as the local authorities, Gwent Police and third sector organisations, and through our regional partnership arrangements to encourage people to improve their health and protect themselves, their families and their friends. We are pleased during the year that we are reporting on that we continue to deliver against our Welsh Government approved 3-year integrated medium-term plan. And evidence of that and our progress is provided throughout our annual report, and it's also reflected in more detail in our performance report. The continuing support of Welsh Government for our plans demonstrates their confidence in our ability to deliver and to continue to develop our services. We all are very grateful to the Welsh Government for their ongoing support. In the year we're reporting against, we also achieved all our statutory financial duties, and this is of course a significant achievement in the light of financial pressures facing the NHS, and our Finance Director Glyn Jones will say a little bit more about that shortly. In conclusion, I wish to emphasise that the Health Board is committed to continuing to progress and develop in the coming year, and also will continue to emphasise and continue to focus on responding to the COVID-19 pandemic. We will continue to realise our Clinical Futures programme with new services, new primary care facilities, and of course the formal opening of our new hospital. In taking these forward, we continue to undertake our business openly, transparently, and provide information publicly on our performance and engage with our local community and our partners. We consider this to be really important. I'm very grateful for the support and feedback we receive from our local communities, and of course we want to continue hearing from people. And over the last 6 to 9 months, we have been regularly engaging with our local communities through Facebook, Twitter, Instagram, and other forms of social media. We now live stream our board meetings on YouTube, on the YouTube channel. And we hope during the next year we continue to build on this engagement and hopefully be able to start some face-to-face engagement with individuals and groups directly. Finally, I'd like to offer a special thank you to Aneurin Bevan Community Health Council for continuing to work with us in such a positive and constructive manner to achieve our joint ambition to deliver the best services we possibly can for our local population and to serve our patients and our communities well. I really do hope you'll enjoy reading the annual report, which of course you can find on the Health Board's website. It'll give you lots of insight into the work of the organisation, what we've achieved in 2019-20, and also our plans for the current year. Thank you very much indeed.
Thank you, Judith. That was very overview. And we can all reiterate your thanks to our staff and our people for the excellent results that we have achieved for communities within Gwent this year. I'll take questions after the presentations if you wish. Glyn Jones, could you talk us through the annual accounts, please?
Okay, diolch, Prynanda. Thanks and good afternoon. It's a pleasure to be here with you and to actually provide an overview of the Health Board's financial performance for what was the 2019-20 financial year. So the 2019-20 financial year started with the approval of the Health Board's IMTP. We were able to set a balanced budget for the financial year, and it was in the knowledge that this would be the final year before the opening of the Grange University Hospital, supported by our network of enhanced local general hospitals. So it was an opportunity to make progress on reducing access times to patients to a number of our services, to pilot and implement new service models and deliver financial improvement in order to put the Health Board in a stronger position ahead of the significant service changes that we knew lay ahead as part of the next stage of our exciting Clinical Futures programme. What we didn't know then was that there would be a global pandemic which would affect our local communities, our patients, staff and the services that we provide as a Health Board during the last few weeks of that financial year, and that it would actually continue through into 2020. So it is in this context that I'm particularly pleased to report that the Health Board has again achieved its statutory financial duties. In addition to having an approved IMTP, the Health Board managed within both its resource and capital resource limits during the financial year and over the 3-year rolling period against which we are measured, and a summary of those results can actually be found in the annual accounts and annual report. But just to sort of formally report here that during that financial year we delivered a small surplus of £32,000 against our revenue resource limit and a small surplus of £28,000 against our capital resource limit. In addition to these statutory targets, we also have a target to manage our cash balances within a reasonable level, which is usually set as about 5% of what we would typically draw down in funding on a monthly basis. So that would equate to around about £6.5 million. At the end of March 2020, we held cash balances of about 1.3 million, which was well within that target. Again, it just shows sort of good cash flow management that the Health Board sort of undertakes. We also have what's called a public sector payment policy target, or PSPP, and that's basically to make sure that we pay at least 95% of our NHS creditors within 30 days of receiving the goods and services that they provide us. Now, this is a really important area as it impacts on the cash flow and potentially the success of our suppliers, many of whom are small and medium-sized companies. They're local businesses, they employ people who live in our local communities. So this is particularly important during the pandemic, when we know that many businesses are struggling financially. So I think it's important to say that our role as a major public sector employer and purchaser of goods and services becomes even more important during this time. I'm pleased to report that we achieved this target for the 2019-20 financial year. And as ever, we continue to look at ways of improving our own internal processes around how we pay suppliers and other creditors more promptly. Managing the finances within the Health Board requires everyone to do the basics effectively and efficiently. So last year we had annual revenue funding of about £1.3 billion. We also had capital funding of over 130 million. That was primarily related to the building of the Grange University Hospital. But these are significant sums of money that we're asked to use wisely and effectively. So making sure we make sensible decisions around how we choose to use our resources is really, really important. So I would like to recognise the hard work and effort of all of our staff, over 14,000 people who I think in their own way contribute to the way that we use our resources and help balance the finances along with delivering safe, effective and high quality care. I think this is a tremendous achievement given the planned changes to services over the coming years and the range of challenges that the Health Board faced last year as we very quickly had to respond to a global pandemic, something which most of us have never had to manage before in our working lives. So as we start to think about and plan healthcare after the pandemic, the Health Board's approach to delivering value-based healthcare, both at an individual level for our patients and for our communities, I think will be essential, ensuring that we make the best use of our resources to improve healthcare as we go forward. Diolch yn fawr. Thank you.
Thank you, Glyn. That was very helpful. And can we move on to Rhiannon Jones, the Director of Nursing Services, to look at the annual quality statement. Rhiannon, please.
Thank you, Chair. Diolch yn fawr and prynawn dda. I have got a presentation, so I'll just put that up on the screen. So give me 2 seconds. Okay, thank you very much. The annual quality statement, or AQS as we refer to it, is a summary of all the achievements across the Health Board from a quality and safety perspective and represents the period 2019 to 2020. It's a Welsh Government requirement to complete the annual quality statement, and it's based on the 7 health and care standards and also the priority actions within our integrated medium-term plan. It is a visual patient-facing document and it was approved for publication at our board meeting in September, which was really positive. I'm pleased to be able to present an overview of the annual quality statement because it is a really positive document which really does outline the
Sorry to interrupt you, Ree. We can't see the presentation.
Oh, sorry.
That's okay. Didn't want you to go on any further.
Okay. No. Oh, that's why. So if I go.
You all right, Rhiannon?
Just sorting it out. Can you see it now?
No.
From the beginning. I tell you what, I'll just run through the slide verbally because that's not good for people. Okay. Sorry about that, people. Technology. So just in terms of the presentation itself, it's a précis of our document, and the document itself is on our website, and it's 59 pages. And even though that's a lot, and there's a lot of information contained within the annual quality statement, that is still only a snapshot of the achievements across the Health Board. And I think that's important to highlight because of the 7 slides that I would have been presenting today. I'm cantering through those, and again, that is a snapshot of the overall performance in terms of the achievements from a quality and safety perspective. What it does identify is examples across all ranges, ages and specialties across the Health Board against those 7 health and care standards themes. Within the annual quality statement and our submission, there is a small reference to COVID because that was really the last month of the 2019-20 reporting period. So there's only a small element, but I know colleagues and the chair have referenced the important work that's taken place and recognised the staff contribution and public contribution in terms of managing in a COVID environment. Just in terms of the 7 health and care standards then, for staying healthy, the principle of staying healthy is about ensuring that the people within our population are well informed and they manage their own well-being. And we've got a number of examples in terms of how we've achieved staying healthy across the Health Board. We had 61.8% of frontline staff that had their flu vaccination, which was above the Welsh Government target. And this is an area of significant importance for us in 2020-2021, not least in terms of the COVID environment, and a significant improvement in terms of the staff uptake already this year. 55% of our population met the physical activity guidelines. We treated 1,610 smokers, and in terms of smokers, they were smoke-free at 4 weeks with that intervention. And we assisted 223 pregnant women to stop smoking during the initial period of their pregnancy. They're really positive and important improvements in terms of the staying healthy standard. In terms of safe care, the principles are to ensure that the people and our population are protected from harm and supported to protect themselves from unknown harm. Again, there's a number of examples of how we've achieved this standard, with 21,136 patient safety incidents reported, with only 83% were no or minor harm. And I think this illustrates that we've got a positive reporting culture. We've had a particular focus for a number of years on reducing inpatient falls. We had 4,381 falls events, but positively 91% of those resulted in no or minor physical harm. But this is a major area of concern for us, and there's a significant amount of improvement work ongoing, to include a recently introduced Falls Collaborative, where we're looking at innovation and technology to help us with this important safe care standard. And additionally, an important area of work has been the Pimp My Zimmer campaign. And this was a coloured walking frame project. 4 hospitals and 11 care homes were involved in this. The Community Health Council assisted with the evaluation of that campaign, which was a really positive campaign in terms of the impact of coloured walking frames for people with visual impairment, cognitive impairment, and the improvements in terms of access to the Zimmer and the reduction in falls and injuries. In terms of effective care, the principle is that people will receive the right care and support as locally as possible and are enabled to contribute to making that care successful. And that's a key principle for our Clinical Futures approach. Health Inspectorate Wales have undertaken a number of inspections across the Health Board, 5 within general practices, 13 within dental, 3 hospital inspections and 2 mental health inspections. And within all of the inspections, Health HIW identified that care was good and that our staff were very professional. Whilst there are a range of recommendations that have been made in relation to those reports, I'm pleased to be able to report that we've got 95% compliance against the recommendations that have been made. And another important area in terms of effective care is that between January and March 2020, 58% of patients with an acute stroke had their scan within 1 hour, and 87% of patients were assessed by a physiotherapist within 72 hours, all of which are aligning to national performance. In terms of dignified care, the standard is that people in Wales will be treated with dignity and respect and will treat others in the same way. I can report that we've had 24 patient safety walkarounds, which are walkarounds undertaken by executive team members and independent board members, and a really important part of our overall governance arrangements, where we see, hear and listen to what staff and patients are telling us about services. As a result of those walkarounds, we have a number of improvement plans and recommendations, and these are a vital part of our overall approach to ensuring safe, appropriate, effective care for patients. In addition, we've had really positive input in terms of our volunteers, with 12 new volunteers a month being trained, and we've got over 100 Friendly Me volunteers that have been recruited. And probably to touch on the importance of volunteering throughout the COVID experience and the vital contribution that volunteers have made, not necessarily in our hospital settings, but in befriending people in their own homes and in the care homes. As importantly, isolation has a significant impact on the mental health and well-being of people. The Community Health Council, and Judith mentioned these earlier, how important the relationship. They've undertaken 89 visits across our services, providing vital and independent feedback. And they've also helped us with undertaking a winter pressures patient experience review, which was really positive, despite the pressures that we're under. And then another area in terms of this work is the intergenerational approach that we've been taken, and we're pleased to announce that 72 primary schools have been twinned with 64 care homes as part of that programme of work, and it's just been phenomenal in terms of the impact. In terms of timely care, the principle is that people will receive timely access to services based on clinical need and are actively involved in decisions about their care. We report that in that reporting period of 2019-20, 77.4% of patients attending A&E, both at the Royal Gwent and Neville Hall, between April and January, were seen within 4 hours. This is below the 95% target, but is an improvement on the previous year. We saw the patient offload department, our pod, implemented in the Royal Gwent to ensure timely transfer of patients and enabling ambulance crews to be released in a more timely manner, which has been positive. 78.7% of newly diagnosed patients with cancer started definitive treatment within 2 months, and that's been an important achievement across the Health Board. And then finally, in terms of individual care, this is that people are treated as individuals reflecting their own needs and responsibilities. I'm going to touch on the fact that we had 1,583 complaints during this reporting period, and 63% were responded to within the required timeframe of 28 days. Our person-centred care team have visited 82 wards to pilot a national patient-reported experience measure, a new tool to ensure that we have vital and critical feedback from patients about their experience. And importantly, we've appointed end-of-life care companions following a successful bid for national monies to promote our ethos that no one should die alone, and our #HoldAHand campaign. So there's just a snapshot of a number of the achievements across the Health Board for 2019-20. And I think these achievements are significant operating in a period of significant stress for our staff, particularly at the end of the reporting period with the COVID pandemic, and is a real testament to our staff and their achievements. Diolch yn fawr. Thank you.
Thank you very much, Rhiannon, for that extremely helpful overview of the type of work that we are undertaking and the standards to which we are striving to improve the outcome of care for our populations. I will go on to the question and answer session, and I'd like to start with the questions that have been submitted by the general public as a consequence of our YouTube feed. And might I start with a question from County Councillor Martin Grocott of Abergavenny, who asks what assurances can be given around the provision of public transport between Abergavenny and the Grange for people who are visiting patients or for enabling staff to get to work. Needing to take several buses or a combination of train and bus is not satisfactory, especially for the elderly and those with a disability. What arrangements will there be for those occasions when the main road between Abergavenny and Cwmbran is closed by flooding at Llanellan, which happens every year, forcing traffic to use the narrow and inadequate gypsy lane between Llanfoist and Llanellan? I think Deborah Wood-Lawson is going to answer this on behalf of the board.
Diolch yn fawr, thank you, Prynawn da. I'll answer each of the questions in turn, if that's okay, Anne. So in relation to the first part, which is around the provision of public transport, the Health Board has worked consistently with a wide range of partners and transport providers and recognises that clarity around access to transport to and from the Grange University Hospital is important to the public and our staff. The average journey from Abergavenny to Cwmbran is 52 minutes by bus and 15 minutes by rail, where there is then a connecting Newport transport bus service going into the Grange University Hospital on a 30-minute frequency. This service will commence from the 9th of November, recognising that as a result of COVID and measures being implemented, public transport timetables may need to change. Recognising the additional challenges presented by the pandemic and that there has been reduced public transport arrangements, and in the light of the early opening of the Grange University Hospital, the Health Board has invested resources to strengthen the transport provision, which includes a Sunday service from Newport. Working with the third sector partners and Welsh Government, the Health Board has also invested resources to strengthen community voluntary transport arrangements for those communities that have less access to public transport. For eligible staff who have no other means of travelling to and from the Grange University Hospital, a minibus provision will be in place for a period of 5 months. The Health Board has also invested in online systems which enable members of the public and staff to access the most up-to-date travel information and options so that journeys can be more easily planned. The up-to-date travel information is available on the Health Board's website. I'll now move on to respond to the second question, which was related to flooding. Since the unprecedented rain of 2019-2020, which saw flooding and resulted in Llanellan Bridge being closed on 2 occasions, the Health Board has been informed that Welsh Government made improvements to the drainage systems in May of this year. However, in the event that a diversion is needed, there are already official diversion arrangements in place by the South Wales Trunk Road Agency, and these diversions are via the A40, the A449 and the M4, with smaller cars and light vehicles being able to use more local roads. I hope that the information provided clarifies and gives a response to the questions being asked. Diolch yn fawr, thank you.
Thank you, Deborah. That was helpful. The second question we've received is from Alan Davis, the chair of Aneurin Bevan Community Health Council. Asks, is the Health Board developing a strategy for addressing the backlog of patient elective surgery following the current COVID-19 pandemic crisis? Could I ask Lynn to start to answer that, and perhaps Claire Birchall will help?
Okay, diolch, thanks. So yes, yes is the answer. We mentioned before that the Health Board normally has a 3-year plan, an IMTP, but I think in response to the pandemic this year, we have been producing quarterly operational plans, and those operational plans include things like how we will sustain essential and urgent surgical treatments. So as we move through the different stages of the pandemic, where it's safe and appropriate to do so, the Health Board has increased the number of elective operations that it's been able to undertake. Just to give you an idea, so during April 2020, when we were going through the first peak of the pandemic, the Health Board performed around 430 elective operations. And since then, this has increased steadily, and we plan to perform over 1,000 elective operations during October. And our recent plan that we submitted to Welsh Government that looks at Q3 and Q4, so the second half of this financial year, sets out the levels of surgery treatments that we plan to perform during the rest of this year. Now, clearly, routine surgery will need to be balanced with responding to COVID and winter pressures, and also assessing the overall risk to patients when coming into a hospital environment. So the Health Board's plans for the remainder of this year involve identifying areas where surgery and the associated interventions can actually be undertaken with minimal risk. This also includes the use of St Joseph's Hospital, which is the independent hospital just outside Newport. And we're also currently looking at other similar facilities outside the Health Board that can offer suitable services. So hopefully that gives you an idea of the plan for the rest of this year. Beyond this year, then, we are working closely with Welsh Government and some of our Health Board colleagues to actually consider options for further addressing surgery waiting times. And this will include looking, where appropriate, at regional solutions beyond the Health Board area. So I hope that's helpful to give you an idea of what we're currently planning. And certainly when we meet as a board, I'm more than happy to give further updates on those plans. Diolch. Thank you.
Thank you, Glenn. I was wondering, would Claire Birchall, who is our Director of Operational Services, wish to add anything?
Yes, I hope you can hear me through my mask. I have somebody popping in and out of my room, so that's why I have my mask on to comply. So I think it's important to note really that there has been an awful lot of work that's been going on because we are conscious that we have a responsibility to manage harm and risk to patients who are have problems that are non-COVID as much as it is in terms of managing patients who are have symptoms or have COVID as well. So the teams have been working tirelessly about how they rebuild our services in what is a very new world from an elective perspective. So treating patients who require planned treatments, diagnostics, outpatients or surgery. Our services obviously look very different to they were pre-COVID, and a lot of that is to do with social distancing and the space that we now have available to us. And in many of our areas, we probably have got between 20 to 40% physical capacity compared to what we had pre-COVID. So a lot of the work that we've been doing has been to adjust and change some of our areas, our outpatient suites, our green paths through to diagnostics, our green pathways through to theatres, to make sure that those areas are safe. We've also spent a lot of time working with our teams to make sure that we've got appropriate preparation of patients, to make sure that we are not putting them at risk, bringing them in for procedures. The most important thing is that we have looked at our waiting list and we've tried to look at those patients who are most at risk of not being able to access these services. And for many, that is cancer and urgent work, but for some, that is follow-up work for people who have chronic conditions, particularly some of our ophthalmology patients, some of our patients that are on some quite complex long-term medication for chronic conditions. And so that work is ongoing in terms of mitigating risk and harm. We're also taking the opportunity to transform some of the way that we provide our services, and we've spoken to and we've heard lessons from a number of our patients and the public about how well those have been received. And that has been through telephone consultation, through video consultation. And there are some national initiatives like a programme called Attend Anywhere, whereby our nursing, therapy and clinical medical teams have been able to have meaningful correspondence and consultations with patients. And patients have told us it's not right for all patients, it's not right for all conditions, but patients have told us that that has been very well received, and certainly some of that is coming through some of our correspondence, which the CHC has been helping us with. Clearly, there are significant volumes of patients who require access, and the most latest surge of COVID has definitely impacted on some of those plans that we had put in place and we had restarted, particularly getting some momentum through September. The Grange opening very much offers an opportunity for us in terms of what space that frees up for safe COVID light areas within our ELGHs that are left behind, and that's the work that we will focus on now, so that we manage the risk which is in front of us, but we also manage the risk of patients who desperately need to access elective care. And that is across the patch, really, from outpatients, therapies, diagnostics, and also for inpatient treatments. So it is very much a priority for us. It features a part of our Q3/4 plan. I think we're very fortunate in the fact that the Grange probably does give us an advantage in terms of that physical space. And it also allows us to redesign some of our services to make them as safe as they can be in our ELGHs.
Thank you, Claire. That was most helpful. I'll go on to question 3, which is from Mary Slater. When will audiology services be resumed? I realise these are close contact services, but surely with masks or other PPE, this would be possible. I'm sure I speak for many others who cannot do without their hearing aids long enough to send them in the post to be serviced. I'm lucky enough to be able to obtain batteries from Chepstow Hospital throughout lockdown, but now we have to order them or ring up and request them. Even a clinic once a week at Chepstow and the other local hospitals would be a great help to so many. I, for one, don't feel confident taking apart the aids to change tubing, etc. I don't think I would either. I know these are unprecedented and difficult times, but I hope you will consider this important request. Claire?
Yes, I think we would acknowledge the importance of hearing aids and our audiology services to particularly vulnerable groups of our population who are potentially may be made more vulnerable because they're not able to access these services and make sure that their aids are serviced or our batteries are changed, tubing is changed. There's a clear experience issue, a safety issue, and also probably a mental health issue in terms of people's ability to interact and carry on their daily life. So it is very much top of our agenda. Our audiology service has obviously been significantly impacted because of the proximity, particularly around hearing and adjusting aids for the population, but they haven't stopped. We've just tried to adapt significantly the way that we provide these services. So one of the first things that they did was implement a phone triage service as a first contact, really, so that very simple requests can be managed remotely. And I know a number of people who have accessed this that actually want to access this way of audiology care going forward. So it's certainly a very quick response, early response for those people. Batteries can be requested by phone, email or text. And generally the phones are manned by the audiologists themselves. So there is a good professional and senior clinical judgment when people ring through. It's slightly more complicated when we're talking about adjusting tubes and retubing and adjusting length of tubes. And we do generally talk to patients' family members to see whether or not they're able to manage that. And we have also sent video links out to try and help people. But we also acknowledge that frequently people who have hearing loss may also have difficulties with sight or dexterity. So we acknowledge that that is not always feasible, but we do offer a postal repair service. obviously we have really been able to provide some face-to-face support, and that is in a number of our boroughs, and we are currently just about to switch on a facility in Chepstow, so we should be able to support Mrs. Slater's needs hopefully very quickly. And we have, if patients are particularly vulnerable, been able to provide domiciliary care visits in houses, but obviously that is for a particular need. Again, this service have tried to be innovative in terms of how they are providing their service, and have used telephone but video links to be able to support people. And they have just secured some additional funding now to try and look at how they can remotely program hearing aids, which is definitely a benefit that has come out of the pandemic. So there are a number of areas where they have tried to provide the service in a different way, still providing face-to-face, but obviously on a much less scale than we would normally, considering the volumes of patients that currently use our audiology services. And we will continue to improve the areas and the numbers of places that we're able to offer face-to-face for those patients who are particularly vulnerable or unable to manipulate their hearing aids themselves.
Thank you, Claire. And am I right in assuming that the phone numbers and addresses for batteries and repairs are on our website?
Yeah, they're very clear. They're also on our detailed in our restart, but we can put something a little bit more specific out in response to this particular concern from Mrs. Slater, just to make sure that we are reaching everybody.
Thank you very much, Claire. Moving on to question 4. This is from Des Hillman. Please, can I ask the board a question regarding the vaccine for COVID-19 when it becomes available? Have they put enough resources into place to accommodate the programme of vaccination of all the public? How will it be distributed and used at a local level? And can anyone refuse to have the vaccination, or is it compulsory for public safety? Could I ask Will Beer for his observations on that question, please?
Jochen, thank you, Chair. I mean, this is a really important question in terms of our overall response to the COVID-19 pandemic, so I'm glad this question has been asked. So the Health Board at the moment has a COVID-19 vaccine programme planning team overseen by a programme board. They're currently putting in place the operational plans and are identifying and securing the workforce that we're going to need to deliver this mass vaccination programme. They're also currently identifying appropriate venues where we can deliver the vaccine or administer the vaccine safely, ensuring that social distancing and all the other infection control measures can be maintained. And then in terms of the second part of that question, I think when the vaccine is licensed and becomes available, it'll be delivered on a stage basis, and that will be based on the vaccine supply, but also in line with the advice we get from the Joint Committee for Vaccine and Immunisations, JCVI. Now, the latest JCVI advice on priority groups for the COVID vaccine was updated on the 25th of September, and that's available on the Welsh Government website. So, Chair, I could share that link with Councillor Hillman after this meeting. But that sets out an interim ranking system for priority groups, which is a combination of both clinical risk stratification and an age-based approach. So that should optimise both the targeting and deliverability of the vaccine programme. And there are 11 groups, priority groups, that are set out there. And then in terms of whether the vaccine will be compulsory, the vaccine won't be compulsory, but we'll be obviously communicating the importance of vaccine in protecting those that are most clinically vulnerable in our population. And I suspect this will be supported by a national campaign as well through Welsh Government. But anyone receiving the vaccine will be asked to provide consent in the most appropriate way prior to it being administered to them. So that's I suppose the answer to the last question about whether it's going to be compulsory, Chair.
Thank you very much, Will. That is the end of the formally submitted questions. Are there any further questions from the CHC, Angela or Alan?
From my perspective, if I could take this, Alan, I just wanted to offer our thanks to all teams, really. I think the corporate team has been amazing. You know, Gwent, the virus hit Gwent first, so I think every team, the comms team, corporate team, frontline staff, you've all been absolutely amazing. So just ditto what obviously Anne, you and Judith have said. So thanks to all staff. It's been a really challenging year, and on top of that, you've had clinical futures, I've obviously been a part of the Clinical Futures Board, and it's been amazing and a privilege to watch your teamwork and see how you've put everything in place. And we wish you well on the opening shortly. Thank you.
Thank you, Angela. Thank you for your very generous comments. Are there any questions from independent members and executive members of the board? No? Well, I know we all have lots of opportunities to ask each other questions, so I'm glad that they have been covered. Well, thank you very much indeed for everybody's contribution today, and also to the members of the public for submitting their questions and for the answers that we have received. Thank you very much to all the board members and representatives of the CHC who've been with us today at our annual general meeting. And I hope everybody who's watched our YouTube channel have enjoyed hearing about the work of the Health Board during 1920 and will join us probably this time next year for our current year's annual review. It's just left for me to thank everybody for their tremendous efforts during this past year and during the current year, and to extend my best wishes for the future and thanks to all the staff, and to hope everybody keeps very safe indeed. So goodbye, hwyl fawr.